When you think about diabetes, especially type 2 diabetes, you probably picture someone who's overweight or obese. And that makes sense because most health campaigns, most doctor visits, and most public health messaging connect diabetes almost exclusively to body weight and narrative. Because every year, thousands of people with perfectly normal body weight, people who look fit, people who don't carry excess fat in the obvious places, are being diagnosed with type 2 diabetes. And many of them had no idea they were even at risk. So what's actually going on here? Is diabetes really just about how much you weigh? Or is there something happening beneath the surface? Something happening inside your body at the cellular and metabolic level that has less to do with your outward appearance and more to do with how your organs are actually functioning? Well, today we're going to break down exactly why thin people can absolutely develop type 2 diabetes. We'll discuss what diabetes really is. At the physiological level, why body weight alone doesn't tell the full story. What metabolically unhealthy thin people actually look like on the inside. And most importantly, how you can assess your own metabolic health regardless of what you see in the mirror. It's going to be a metabolic one, so let's jump into this anatomical and physiological awesomeness. Now, before we get into why thin people are at risk, we need to make sure we're all on the same page about what type 2 diabetes actually is. Because diabetes isn't just about blood sugar being high, that's a symptom. The real problem is what's happening with a hormone called insulin and how your cells respond to it. And once you understand that fundamental process, everything else we talk about today is going to make a lot more sense. So let's start with the basics of how your body normally handles glucose and insulin. And then we'll discuss what goes wrong when someone develops type 2 diabetes, regardless of their body size. So when you eat food, especially foods that contain carbohydrates, your digestive system breaks those carbohydrates down into glucose. Glucose is a simple sugar, and it's one of the primary fuel sources for your cells after you eat. That glucose gets absorbed into your bloodstream, and your blood glucose levels start to rise. Now, your body doesn't want glucose just floating around in the blood indefinitely. It needs to get that glucose out of the bloodstream and into your cells where it can actually be used for energy or stored for later use. And this is where insulin comes in. Insulin is a hormone produced by your pancreas, specifically by clusters of cells called beta cells. When your blood glucose levels rise after a meal, your pancreas releases insulin into the bloodstream. Insulin then travels throughout your body and binds to insulin receptors on the surface of your cells. Think of insulin as a key that unlocks the door to your cells, allowing glucose to enter. Once insulin binds to those receptors, it triggers a series of events that allow glucose transporters to move to the cell membrane and bring glucose inside the cell. This process lowers your blood glucose levels back down to normal. Now, type 2 diabetes develops when this system stops working efficiently. And the core problem is something called insulin resistance. Insulin resistance means that your cells stop responding properly to insulin. The insulin is still there, the key is still turning in the lock, but the door isn't opening as easily as it should. So your pancreas has to produce more and more insulin to get the same amount of glucose into your cells over time. Your pancreas can struggle to keep up with this increased demand. And when it can't produce enough insulin to overcome the resistance, glucose starts to build up in your bloodstream. And that's when blood sugar levels become chronically elevated, which is the hallmark of type 2 diabetes. So now that we understand what type 2 diabetes actually is, let's address the big misconception for decades. The narrative has been pretty straightforward. Excess body fat, especially obesity, increases your risk of type 2 diabetes. And that's absolutely true. There is a very strong correlation between obesity and type 2 diabetes. In fact, the majority of people with type 2 diabetes are overweight or obese. But here's where things get interesting. Correlation doesn't mean that body weight is the only factor, and it definitely doesn't mean that being thin protects you from diabetes. Because what we've learned from metabolic research is that insulin resistance isn't caused by body weight itself. It's caused by what's happening inside your cells and inside your organs, particularly in your muscle tissue, liver, and fat tissue. And those metabolic dysfunctions can absolutely occur in people with normal body weight. In fact, studies estimate that anywhere from 10 to 20% of people with type 2 diabetes have a normal body mass index. And in certain populations, particularly among people of Asian descent, that percentage can be even higher. So why does this happen? Well, the key is understanding that not all fat is created equal, and not all thin people are metabolically healthy. You can have two people who weigh the same, who look similar on the outside, but have completely different metabolic profiles on the inside. One person might have most of their fat stored subcutaneously, which means just beneath the skin. Subcutaneous fat is actually relatively metabolically benign. It's not ideal to have excess amounts of it, but it doesn't directly interfere with insulin signaling in the same way that other types of fat do. But the other person might have fat accumulating in places where it shouldn't be, and this is called ectopic fat deposition. Ectopic means out of place. And when fat starts to accumulate inside organs like the liver, inside muscle tissue, around the pancreas, or deep in the abdominal cavity around your internal organs, that's when serious metabolic problems start to occur. And importantly, you can have significant amounts of this ectopic fat even if you have a normal body weight, and even if you look thin from the outside. So let's talk about what happens when fat starts accumulating in the wrong places, particularly in the liver and in muscle tissue, because these are the two most important sites when it comes to insulin resistance. Let's start with the liver. Your liver plays a major role in regulating blood glucose levels. In between meals, when you're not eating, your
This
liver
process
actually
helps
releases
maintain
glucose into your bloodstream to keep
homeostasis.
your blood sugar stable. But when you eat a meal and insulin levels rise, insulin is supposed to signal the liver to stop releasing glucose and start storing it instead. However, when fat accumulates inside liver cells, a condition known as non-alcoholic fatty liver disease, this process gets disrupted. The liver becomes resistant to insulin signals. So even when insulin is present, the liver keeps pumping out glucose when it shouldn't. This contributes to elevated blood sugar levels even when you haven't eaten. And here's the critical point. You can develop fatty liver disease without being overweight. It's estimated that up to 20% of people with fatty liver disease have a normal body weight. And this is often driven by diet, particularly diets high in added sugars and refined carbohydrates, as well as genetic factors and low levels of physical activity. Now let's talk about muscle tissue. Your muscles are one of the largest glucose sinks in your body. After you eat, a significant portion of that glucose should be taken up by your muscle cells, where it's either used for energy or stored as glycogen. But when fat starts to accumulate inside muscle cells, those cells also become insulin resistant. They stop responding efficiently to insulin, which means glucose can't get into the muscle tissue as easily. And again, you don't need to be overweight for this to happen. People who are sedentary, even if they're thin, often have poor muscle quality. Their muscle tissue may contain more fat and less actual contractile muscle fibers. And this significantly impairs insulin sensitivity. In fact, one of the strongest predictors of insulin sensitivity isn't your body weight. It's your muscle mass and your level of physical activity. Somebody with more lean muscle mass and higher levels of regular physical activity will almost always have better insulin sensitivity than somebody who is thin but sedentary with low muscle mass, even if they weigh the same. But there's another critical factor we need to discuss, and that's visceral fat. Visceral fat is the fat that accumulates deep inside your abdominal cavity, surrounding your internal organs like your intestines, liver, and pancreas. And visceral fat is metabolically very different from subcutaneous fat. Visceral fat is highly active. It releases inflammatory molecules called cytokines, and it releases fatty acids directly into the portal circulation, which goes straight to the liver. This creates a perfect storm for insulin resistance and metabolic dysfunction. And here's what makes this so relevant to thin people. You can have significant amounts of visceral fat even with a normal body weight. Some people are genetically predisposed to store fat viscerally rather than subcutaneously, and you can't see visceral fat from the outside. Two people could have the same waist circumference, but one might have most of their abdominal fat stored subcutaneously, while the other has it stored viscerally. And the person with more visceral fat is at much higher risk for insulin resistance and type 2 diabetes, even if they look equally thin. There's also a strong genetic component to all of this. Some populations, particularly people of South Asian, East Asian, and Hispanic descent, are at higher risk of developing type 2 diabetes at lower body weights. And part of this is because of genetic differences in how and where the body stores fat, as well as differences in pancreatic function. Some people's pancreases simply don't compensate as well when insulin resistance starts to develop. So even mild insulin resistance can lead to elevated blood sugar levels more quickly in these individuals compared to others. And this brings us to one of the most important takeaways from today's video. Your risk of type 2 diabetes is not determined by the number on the scale. It's determined by your metabolic health. And metabolic health is influenced by where you store fat, how much muscle mass you have, how physically active you are, what you eat, your genetics, and how well your organs are functioning. You can be thin and metabolically unhealthy, and you can be overweight and metabolically healthy, although the latter is more complex and still debated. But the point is that body weight alone doesn't tell the full story. So at this point, you're probably wondering, okay, how do I actually know if I'm at risk? How do I know if I'm one of those metabolically unhealthy thin people? Well, the good news is that there are several markers you can track, and many of them can be measured with standard blood tests that you would get during an annual physical. So let's go through the most important ones. First, fasting blood glucose. This measures how much glucose is in your bloodstream after you haven't eaten for at least 8 hours. A normal fasting blood glucose level is generally below 100 milligrams per deciliter. If your fasting glucose is between 100 and 125, that's considered prediabetes. And if it's 126 or higher on 2 separate tests, that's diagnostic of diabetes. Now, importantly, fasting glucose can be normal for a long time even as insulin resistance is developing, because your pancreas is still compensating by producing more insulin. So fasting glucose alone doesn't always catch the problem early. That's where hemoglobin A1C comes in. Hemoglobin A1C measures your average blood glucose levels over the past 2 to 3 months. A normal A1C is below 5.7%. An A1C between 5.7 and 6.4% indicates prediabetes, and an A1C of 6.5% or higher indicates diabetes. This test is useful because it gives you a longer-term picture of your blood sugar control, not just a snapshot from one moment in time. Another important marker is your fasting insulin level. This test isn't always included in standard blood work, but it can be very informative. If your fasting insulin is elevated, that's a sign that your pancreas is having to work harder to keep your blood sugar normal, which suggests insulin resistance. Generally, a fasting insulin level below 10 microunits per milliliter is considered good, but some metabolic health experts suggest aiming for even lower, closer to 5 or below. You should also pay attention to your lipid profile, particularly your triglycerides and your HDL cholesterol. Insulin resistance often causes triglycerides to go up and HDL cholesterol to go down. If your triglycerides are above 150 milligrams per deciliter, and your HDL is below 40 for men, or below 50 for women, that can be a red flag for metabolic dysfunction, even if your total cholesterol looks fine. And finally, waist circumference can be a useful marker, although it's not perfect. Men with a waist circumference above 40 inches and women with a waist circumference above 35 inches are at higher risk for metabolic problems, including insulin resistance. But remember, you can have a normal waist circumference and still have problematic levels of visceral fat or ectopic fat inside your organs. So if you've discovered that your metabolic markers aren't where they should be, or if you just want to reduce your risk regardless of your current numbers, what can you actually do about it? Well, the good news is that insulin sensitivity is highly modifiable, and the interventions that improve it are the same foundational health behaviors we talk about all the time. On this channel, first, exercise, and specifically, resistance training combined with regular cardiovascular activity. Resistance training builds muscle mass, and muscle is one of the most insulin-sensitive tissues in your body. The more muscle you have, and the more you use it, the better your insulin sensitivity will be. Cardiovascular exercise also improves insulin sensitivity and helps reduce visceral fat. Aim for at least 2 to 3 days of resistance training per week, and at least 150 minutes of moderate intensity cardio per week, or 75 minutes of vigorous intensity cardio. Second, diet focus on whole, minimally processed foods. Reduce your intake of added sugars and highly refined carbohydrates, because these are the primary drivers of insulin spikes and fat accumulation in the liver. Prioritize lean proteins, healthy fats, vegetables, fruits, legumes, and whole grains. And pay attention to portion sizes and total caloric intake, because even healthy foods can contribute to fat gain if you're consistently eating more than your body needs. Third, sleep. Poor sleep and chronic sleep deprivation have been shown to significantly impair insulin sensitivity. Aim for 7 to 9 hours of quality sleep per night. And if you have sleep disorders like sleep apnea, get them addressed. because sleep apnea is strongly associated with metabolic dysfunction. And fourth, manage stress. Chronic stress leads to elevated cortisol levels, and chronic cortisol elevation can contribute to insulin resistance and visceral fat accumulation. So find sustainable ways to manage stress, whether that's through exercise, meditation, therapy, social connection, or other stress reduction strategies that work for you. And of course, if you're in a higher risk category, whether because of your genetics, your family history, or your current metabolic markers, stay on top of your health maintenance. Get regular blood work done. Know your numbers, and work with your healthcare provider to address any issues early before they progress into full-blown type 2 diabetes. So bringing this full circle, the idea that type 2 diabetes only happens to people who are overweight is one of the most persistent misconceptions in health. And it's a dangerous misconception because it leads thin people to believe they're immune, when in reality, metabolic dysfunction can absolutely develop regardless of body weight. What matters isn't how much you weigh. What matters is where your fat is stored, how much muscle mass you have, how physically active you are, what you're eating, and how well your organs are functioning at the metabolic level. And this is exactly why focusing on foundational health behaviors, like consistent exercise, quality nutrition, adequate sleep, and regular health monitoring is so critical. These aren't trendy optimization hacks. These are the fundamental pillars that actually protect your metabolic health over the long term, regardless of your body size. If you found this video helpful, make sure to subscribe to the channel for more content on how your body actually works at the anatomical and physiological level. We break down complex health topics into practical, science-based information you can actually use.